No, it's okay. Hi, everybody. Thank you for joining us again. I'm Scott. I'm the Chief Exec of the Institute of Employability Professionals, and it's my pleasure to welcome you today to the fifth in our series of 8 webinars in partnership with the Better Health Generation. Thanks to Kylie and the team, Natalie and Andy here in the UK, and Kylie all the way over there in Australia on the other side of the world. Can you believe it's night time there? It's it's getting late, and Kylie's very kindly doing these webinars for us at this time over in Australia. This week's webinar, as you know, is called The Benefits of Digital Health for Your Clients. I think we're going to learn some incredibly interesting things today about how we can support people better. Do make sure you sign up for the rest of these webinars in the series when the links are published through the IEP Learning Network e-bulletin. Stay well, stay safe, and get chatting on the chat link. Please remember, as Helen says, to change your settings to all panelists and attendees, and then we can hear and see what you're doing. And make sure that you sign up for the webinars on our YouTube channel. They are available to there, and if you subscribe, you'll get a message saying when the new ones are posted to the channel. So over to you, Kylie, and thank you again.
No worries. Thank you, Scott. I think it's really great that people are using the chat. IEP definitely supports the networking of everybody who's on this line. So if you can get those settings correct, chat with some people that you haven't chatted with for a while, and let's see if we can squash this isolation through social connectedness via the chat. So as Scott mentioned, my name's Dr. Kylie Henderson. I'm a clinical psychologist. I have my 20-year practicing certificate in my office here somewhere, which is quite scary, but I guess the reason why I tell you all that is because for the last 15 years, people have been bringing telephones into therapy as a way of recording and measuring their mental health. So if you've ever been to a psychologist before, one of our most favourite questions when you walk in the door is, how has your week been, and tell me about how you've been feeling. Now that question is often answered with a myriad of responses, but sometimes, and more regularly in my career, I recognised it being answered with really crap or shit, or I can't tell you how bad it was, Kylie. And I guess for me, what I recognized when somebody's suffering from a mental health condition, they do sometimes see the world through a fairly negative lens, and therefore their predictions about how the week's gone for them when I asked them that question were always quite overinflated on the negative side. So 15 years ago, I kind of got sick of asking that question, but it's an important question, and it obviously builds on rapport if you actually listen to the response. But when I started listening to that response, I started asking people more questions. So you said that your whole week was really awful. Tell me about Monday. What was Monday like? Tell me about Tuesday. Tell me about Wednesday. And as we went through the days of the week, it was fairly obvious that there was a common theme coming through. And that theme was that people, when they rated each day and they thought about what had actually occurred during the day, had a more realistic and accurate measure of how they were actually going. So the world has changed dramatically in 15 years, and we now see regularly clients bringing their telephones into therapy and into health settings all the time. We have, in both countries, the UK and Australia, the electronic health record. The use case for that in allied health services in psychology is quite low. But I can see the benefit of digital health, and I saw it 15 years ago when we started asking more questions and inquiring about people's health. So tonight's session is really about where that journey's taken me in the last 15 years. I certainly don't call myself a tech expert, but I've put myself out there to discover and try to innovate to ensure that we can get those measurements from our clients in a more accurate way. And I've said this to you all before, that when we understand exactly how somebody's feeling, we can match the appropriate intervention at the right time. So nobody is going to chop down a bonsai with a chainsaw. We need to really think about the level of emotional functioning that somebody's having versus the strategy that we're going to use for that particular moment. So that's my kind of intro on why I'm talking about digital health and how I got here. You've heard before about the Better Health Generation, and Natalie's going to give you a little bit more of an overview at the end of tonight. And I think what we'll do is just launch straight into the slides, and let's talk about where digital innovation has got to so far. So we're talking about tech and we're talking about innovation. So I thought I might include these caricatures of the Better Health Generation UK leaders. So that's me on the left, Natalie in the middle, and Andy, I'm sure, is better looking than that, but that's the caricature of Andy as well. We use these pictures and images as part of our digital health brand, which is called Your Health Plus. And that's probably the main area of our business that I'll be talking about tonight and drawing on their expertise. So let's talk about innovation in health overall, because mental health is part of the health sector. What's going on there? I just want to give you a quick update on what's going on. We've got these most amazing robotics and innovations where we have surgeons in the UK going out to small regional locations, providing surgery through robotics while sitting in their offices in London. I mean, that is pretty amazing to me that we can be doing that in small, vulnerable countries, not just in regional areas in London. We have a range of biosensing wearables, and many of us have probably got an Apple Watch or a Garmin or a Fitbit. But we're also using that in the inner soles of shoes to help measure things like our blood pressure, our weight and our balance. You know, we've got the inner soles in shoes are working for assisting the elderly in their homes to make sure that we monitor that they're still standing up. We obviously have digital hearing aids, which have significantly improved in the last 20 years. And on top of that, we're using portable digital imaging equipment such as the Microsoft glasses, where we're seeing people having x-rays actually compressed onto their bodies. So previously we would see the surgeon would see an x-ray and watch it on the screen over here as they're providing surgery over here. But now through these HoloLens Microsoft glasses, they can put on the glasses and see the x-ray over the top of the person that they're doing surgery on. I mean, what a fantastic innovation to be able to bring that through those glasses right into the room. And that innovation has improved the way that we also train doctors and improved, I guess, a range of the health professions. The challenge in that space, though, is that we have, it's a really expensive technology and it's not being utilised probably to its full extent. As the technology improves, obviously the price does go down a little bit more. On top of that, we have ingestible sensors. So we've got people ingesting small devices that can trigger off various either glucose or other types of medication through testing and detecting through our internal systems. And that includes cameras as well as the glucose pills and so on. On top of that, we've also got this amazing 3D imaging equipment that's going on in health. No longer did you need to have your arm in a cask. We can use 3D imaging to fit that cask completely to your arm. And what that's doing to the improvements in healthcare is it's speeding up recovery. And all of these innovations in health are aimed to either firstly save someone's life, but secondly to speed up the recovery of the person and individual. So it's pretty amazing to think about all these technologies. The last one there is really about smart detectors and how we're using those to help to either track what someone's daily movements might be, to see if an elderly person has moved to the fridge or come back from the fridge, and to track exactly their pathway that they're using for the day. So we can look at things like activity levels, we can look at things like whether they're eating, whether they're still in bed all day, and their levels of activity during the day. The other really cool innovation I saw late last year was a loneliness badge, where we created a badge out of 3D material where a person in their homes could wear this badge. It was a badge of significance because it was printed with some type of memorabilia of theirs, and it would sit on their chest and measure the number of words that that person said per day. And what it did is would alert different family members if they didn't say enough words for the day. So we're really trying to tackle loneliness. We're really trying to tackle saving people's lives as quickly as possible. And we're really trying to tackle in health how we can do it quicker and better. I guess the question gets raised though, with all of this innovation, what is going on in mental health? We're spending significant amounts of money in innovation and grants around healthcare. What are people doing in mental health? Where is the innovation in that? I have to tell you, it's not as sexy as any of these things that I've got on the screen. We know, and you've heard me talk about this before, that the burden of disease in mental health is significantly growing. It's growing up there with the top 5 areas of burdens of disease, things like obesity, stroke and heart disease. 1 in 4 people in the UK will experience a mental health condition each year. And that number has risen. It's risen since I started practicing 20 years ago, where we used to talk about 1 in 5. Now we're talking about 1 in 4. So the numbers are rising, the investment's rising. We know in the UK before COVID-19 even was on the radar, we spent $12 billion on mental health in the UK, and the numbers are still rising. So here's what's going on in mental health. Interesting. We're starting to do telephone therapy. You know, that was one of our innovations. I mean, seriously, telephones have been around for a very long time. And I think in the 1980s, we proved, and it was in the UK, that telephone therapy works. So there's one of our current innovations. We then extended that to video call and mediums like we're on tonight. Not surprisingly, it did improve some of the outcomes over telephone therapy, because you could then see and look at the patient and build better rapport more faster over video. We then have some internet delivered therapies. So there's been a range of different programs where patients can go onto a website and start really looking at ways of doing kind of self-treatment, or if you like, ICBT style programs. We then have this internet chat-based messaging therapy, and for those technology nerds out there, that's where we would use the chat bots, where you'd plug something in and the robot would respond to you. Now, I had a really interesting experience with that last year, where I thought I would give myself therapy. I didn't need therapy, but I thought I'd try it out and I'd test it out. So what I did is I downloaded the chat bot and started talking to it. It was pretty amazing, the things that it picked up in my chat with the bot. But what it didn't do is help me when I was in crisis. So I chatted to the bot and told the bot that I was going to top myself tonight to see what it did. But the response came back, would you like Kylie to do the top yourself module? And obviously it didn't work. It can't pick up the nuances that we have in mental health and the way that people describe their feelings. So robotics, automation, and AI, and some of those systems that try to really understand what people are going to say next and what is in the pattern of the words that they say is really tricky in mental health, because we've got slang and terminology that comes into play, and it's really risky. I mean, if I was to have given that to one of my young clients, that would be the exact wording and phrases that they would use. And the response there is quite mixed. So we have research going on with chatbots to see how it goes. But I think from a clinical perspective and a practical perspective, the jury's out for me on that innovation. We've got smartphones and patient monitoring systems, and I'm going to talk about a case study tonight around that. We have virtual reality, again, a really amazing innovation to be able to place a client into a virtual setting to get them to test out some type of behaviour or some type of interaction that they'd like to have in a non-threatening environment. The technology there is pretty fantastic when you think about how it could be applied to our work setting. We could really have a virtual workplace that we have people moving into that workplace via their virtual glasses and building their work capacity, whether it be their communication capacity or their physical capacity, in that setting with a health professional watching them. So I've seen some really cool back care programs where we've got someone virtually walking into a warehouse and doing the lifting and standing as they should do, not as they had been in the past, and their behaviours can be corrected immediately through that technology. Pretty exciting stuff, but pretty expensive stuff too, because when you start to simulate a workplace, you can imagine the multiple different types of workplaces there are, and how we ever get to a place where there are 200 or so options for a job seeker to choose and to practice in. I'm pretty unsure how we'll get there. The other part about that is that to make it really effective, virtual reality needs to look and feel like real people, not like you're in a comic series. So it's going to be a longer journey, I think, for virtual reality, but it is here and it is already showing some really good promise. We currently have a virtual reality PhD program that's looking at placing people with autism into a simulated workplace so that we can modify the sensory stimulation that they're gaining from that workplace to see what is the optimum level to help that person to perform at their best. So you can see how there's some really cool stuff going on there. But again, that's one workplace. That's not the 200 different workplaces that we will need to be able to have our job seekers test this out in reality. We've got social media and gaming. The jury's a little bit out in the research on this one too. So we've used gamification to help young people to start addressing their mental health. There's really mixed results, and it's about 50-50 whether gamification's working. And I say that because people don't want to be rewarded for getting 50% of us don't want to be rewarded for addressing our mental health, and the other 50% of us are quite interested in gaming. And the psychologist in me says that gaming and the pokies and all of those other types of stimulations probably aren't the best way for us to address mental health in an innovation space moving forward. So that's kind of all that we have in mental health at the moment when we think about the innovations you saw previously, this is kind of where we're at. Not surprising, and it would be remiss of me to not to talk about apps. We've all got a lot of apps we probably download, and at the moment in 2017, and this is the latest data I could get, and we're now in 2020, 318,000 health-related apps are available in the App Store. Every day there are at least 200 more apps being added to the App Store. Now, if I add those figures up and calculate those 200 by 365 and the 3 years, you know, we're getting close to 500,000 apps, health apps. We've got 340 different types of wearable devices that we're using, and 55% of us are actually tracking sensor data via our phones. Some of us probably don't know about it, but it's actually there. It's in the, if you've got an Apple, you just press the little heart app and it'll show you all of your sensor data for the day. And that's all the biometric data, the steps, the heart rate, the walking, and those types of things. So what do we do about this? I can tell you now the Australian government is really concerned. That the Australian Government Digital Health Agency, I sit on an advisory panel for them. They're really concerned about health apps because they know that an app coming out of the middle of, I don't know what country, middle of some random country, and sitting into the Australian Apple Store with no efficacy and no evidence to say that it works is a worry, and it's a concern to the government because they don't want to be held liable for somebody using these apps and something going seriously wrong, like the Top Yourself module that I did. So it's a real worry. So our government has at the moment decided that they're never going to be able to keep up with the quality and efficacy of these tools. And as part of that, they've decided to start investing in developing quality measures for apps. So rather than rating each of these 500,000 apps that are available in the App Store, they've decided they'll find a measure to try to educate consumers, and that's you and me, on what is a really good mental health, digital health app. So the University of Queensland is currently driving that project with the Australian government in Australia. So it'll be interesting to see what they come out with. So let's talk about a case study though. Let's talk about how you might apply digital health into the different settings that you're working in now. Here's what we did in our case study to see if it works. We looked at 2 different populations. We looked at, I'll just annotate here for you. We looked at one population just receiving face-to-face services, and we looked at another population that was receiving face-to-face services, but also receiving a digital health app. So the idea was that we would see improvements in the second group because they had more touch points to address their mental health than the previous group that just had the face-to-face. So if you liken this to employment services, it might be you've got your weekly or fortnightly or monthly in some areas face-to-face sessions. We'll continue those face-to-face sessions, but we'll also add in Your Health Plus to increase the engagement and the access and the touch points that we can have with people. So here's what we did in this study. I'm sure you're not going to be surprised by the results when you compare face-to-face versus face-to-face plus digital health. Here's what we did. We gave the advisors a dashboard, and that dashboard measured all of their clients' well-being and their confidence returning to work. The job seeker had an app that they used, And then within that app, they were able to do mental health, wellbeing, vocational and educational programs. If they needed, they had a health professional that they could virtually dial in to chat about these activities and events, because remember I said before, technology is not going to solve the problem. It's going to need to be an adjunct to what we do in face-to-face therapy. So we had that support mechanism there waiting if we needed it. So I guess the client in this case had access to daily rating their well-being and their mental health. And if you come back to the story that I used at the start, the well-being and mental health of each person each day is a better measure than asking them, so how's your week been? So this gave the clients an opportunity to rate each day, kind of a bit like an Uber rating how they're going. There was an opportunity for them to book sessions with either their advisor or their health professional. And there was a library of really good information in there that would lead them down the pathway that they wanted to go. And in this case study, it was university. There's also a list of challenges where they could actually apply the skills that they needed. Rather than just looking at the information and reading the information, we wanted to make sure they were applying it to their lives. There's a section in there where they could explore their different ratings. And again, back to my story at the start, you can see how the patient could then track how their mood was going over time and apply the right strategies, which were in the tool anyhow, when they needed them most. The other thing about exploring is that there's been a lot of research in health to demonstrate when a patient or a client owns their own health data, that they become more empowered and more likely to improve over time. So all of that data has been around in the UK and Australia for many years, and it came actually initially from the UK around the electronic medical records that you guys were first off the rank with. There's also some tools that we gave the job seekers tools that they could use. These were things like mindfulness tools or helpful thinking tools, time management tools, a range of tools that they could come back in and use as often as they'd like. And if they wanted to develop an action plan, they could have developed an action plan. So here's some of the different library content that we gave them. Some of the different well-being, healthy eating type programs. Some of the different tools, I mentioned meditation, but this one's also a breathing tool that they could come in and practice as many times as they wanted. Now, what were the results? Let's talk about the results. When we added digital health, what we found compared to just face-to-face was that we improved well-being by 17%. After a 3-month period, the group that received face-to-face intervention and Your Health Plus had a 17% increase in their well-being compared to the other group. We knew that they were accessing, and whenever they did access Your Health Plus, they were doing that for approximately 7 minutes. So it was a quick touch point, but it was a quick regular touch point that they could have where they were addressing their well-being. This also led to an increase in empowerment. They felt more empowered to do something about their mental health and their well-being. And again, that research has been around for a long time when we look at the electronic medical records. Interestingly, we saw that this group overall, on average, their mental health symptoms decreased by 9%. Now, for any of you out there that have had the time to read my PhD, when you significantly change your mental health symptoms, it increases the speed that you would go back to work. So to me, decreasing symptoms means that, and it sounds all backwards because it says decreasing symptoms, but when you report how depressed you are, you would normally say, I'm 90% depressed, or I'm 70% depressed, or so on. So this is decreasing depression by 9%. And when we do that, often you'll see mood stabilize for a little bit. And it's at that opportunity that people can return to work. And we see that happening because we don't need to cure someone's mental health to get them into work. So the case study really proved to us that there was something that we could do, and very little amount of time, but increasing touch points by 7.46 minutes to improve someone's mental health on top of what we already do face to face. So to summarize digital health and where we're at, before COVID-19, the UK government spent £12 billion on mental health. We already know, and we are predicting a second wave of a pandemic is coming. And it's coming because of the fallout of jobs. It's coming because of the change, the loss of status, and the multiple rippling effects that isolation, shutdown, and all of these events have had on our lives. So in psychology, we're calling it a second wave. And I'm really concerned what that means from a spend perspective, what the government's thinking, and I'm not sure what your government's thinking. It's not clear to me in the media what's going on around mental health and what we're calling in Australia certainly the second wave. The challenge we have, though, is that we are on the forefront of this. This will be, we will see more unemployed people than we'll ever see, I think, this year. So how do we help? What do we do about this? I think one thing's for sure, when it comes to mental health, it is not just the health department's issue. It is not just a psychology issue. It is an us issue. We have to all work together to be able to provide our bit to help people. There's certainly room for innovation. There is room for innovation with proven digital techniques. We need to start thinking about, and as someone said to me recently, the genie is out of the bottle now. We're all communicating digitally. Isn't it fantastic? It's only taken this significant event in the world to have us all be okay with technology and be getting therapy through technology. I mean, it's fantastic. But digital tools will increase access. If we include digital tools in our service delivery models, we can access more people. And guess what we're going to need to? We can also means that we can help clients improve faster. You saw the data. It works. It helps people to get better faster. And lastly, how much more powerful can we be when we give people evidence-based tools and they take ownership of it? When clients and patients take ownership over their mental health, they get better. It's about self-actualization. When they feel they can do something about it, they become self-actualized, and their mental health changes in that moment. So that's about all from me around digital health. I wanted to give you that overview of what's going on in the broader sector, what's coming up, what are the opportunities on the market at the moment. If you're looking at innovation, what should you be looking for? What's the research saying? Stay away from robots just at the moment when it comes to mental health. They're working in surgery, but they're not working at the moment in mental health. I hope they do at some point, but follow the evidence and check the evidence. If any of you have access to Mendeley, it's a great place to research and look at the articles coming out of universities and some of our departments to show you what the efficacy of some of these tools are. So traditionally, universities are a little bit slow to the market, and what we find in publications and research is that the technology is about 3 years old, because by the time you do the study and then you publish the results, and then it goes to a journal and it gets published again. And there's a bit of a lag. So be mindful of that when you're reading papers, that technology is changing really fast and sometimes journals are not keeping up with that. So we need to look to other sources. Before I move on to the Q&As, I just thought I might invite Natalie Keating, our CEO of the UK, to just have a quick speech about an introduction to the workshops that we presented and introduced last week. So Natalie, do you mind joining us?
Yes, the video will not, I can't seem to come on video. It's just not allowing it. It's saying because I'm not the host, I can't actually switch my video on, but hopefully you can hear me because I'm the mute, that's not a problem, but the video will not switch on. Okay, so we're going to be running two sets of programs. One is appropriate for job seekers and it's based on the Thrive model. The courses are going to start from the 12th of May, and there's also going to be a program that's appropriate for employability staff, and we've set those around lunchtime, so staff learn and lunch session, so they're going to be running at 12:30 until 1:30 for staff members, and the job seeker program will run at 11 a.m. until 12. The idea of the program is to support staff, whether that's a trainer, and generally they would normally operate as an advisor or a support manager. And the program is to support you with your clients in this time that we are operating in at the moment, helping you to build the rapport, the goal setting, resolving conflict, and I suppose how to get the best from yourself to give to the client using telephone video services as we are at the moment. And the program is six sessions across 6 weeks. It's £25 and we have got limited numbers. We did launch it last week and we've had a lot of interest since then, but we are still, the program is still open, so if you're interested, please contact myself or Andy so we can book you onto that. With regards to the job seeker program, we've only really just launched that one, and that is appropriate for any job seeker, however far away from the labour market or close to the labour market they are, because the program is going to be quite varied and appropriate to their needs, supporting them through this time. And we will start to look at work in the third session. What does work look like now? There are still employability opportunities out there, so it's about making sure that we focus on those and how to land that job in the current times. So two quite different programs, clearly linked, so job seeker program and employability staff, and very much it's about supporting us through the times that we're all in at the moment and making sure that performance is still met for the programs that we run.
Thanks, Natalie. So I've just had a couple of questions in the question box. So Sue's asked, do I think that COVID-19 will actually improve people's mental health? Because at the moment she knows a couple of people who would normally be suffering from depression that are being more positive about the current circumstances. I think you're absolutely right, Sue. That's a great question. What we saw on the data for the UK, and I presented it last week, was that on the 1st of March, people's level of contentment dropped significantly on the 1st of March and towards the middle of March. But then it kind of hockey sticked up a little bit. I think as we started to realise this is our new normal, we started to adapt, and that's part of, you know, humankind. We do start to adapt to a change in an environment. But what I fear for the people that might have a mental health condition, and not just a sadness, and I've talked before about the difference between the sadness about the current circumstances and a mental health condition, is that right now is a fantastic distraction where everybody's in the same boat. But when things do go back to normal, and it won't be normal, it'll be a new normal, that'll be when some of our peers and colleagues and clients are most at risk, because they'll see other people going out to work, they'll see other people starting to bounce back, and they might not be. So I hope that answers your question, but I think you're absolutely right. There are certainly some people whose mood has become more elevated as we adjust. What are the safest options for digital solutions? In relation to digital solutions, London and the UK is exactly the same as Australia. The speed and rate of new solutions on the app stores is scary to me as a clinician. And the other part about that is that on the App Store, it just shows you how much people like it. It doesn't show you whether it's effective or not. And that's really worrying, because when you do search, and there's another question about searching for Your Health Plus, when you do a search on the App Store, it shows you the app that people like the most first. So liking it doesn't necessarily mean that it's changing their mental health or improving them over time. A good example of that is the Calm app. It's the most popular mental health app in Australia. It only does meditation. Those of you who know about the treatment of mental health, meditation is only one element of a toolbox of 100 different therapies to try. So if you wanted to try a safe option, look for things like the CE marks, look for things that demonstrate quality, and ask for the evidence, ask for how it's working. And someone's also asked about Your Health Plus on the App Store. We don't have Your Health Plus on the App Store because it's not designed to be an app that somebody would just download from the App Store. At the moment, we use Your Health Plus in Australia with employability providers, apprenticeship providers, universities, and it's more a product that goes kind of B2B rather than probably B2C in that space. And the reason for that is it's customizable, so we can customize it to each apprenticeship provider and what their needs are. Any other questions, Helen, that I might have missed?
No, you've covered all of the questions that we've had today. Thank you, Kylie.
That's okay, guys. Next week, we're doing a presentation that's about you. We're back off clients and we want to talk about resilience and emotional intelligence. I've already drafted the webinar for next week, and I'm including in that webinar an assessment of your level of emotional intelligence. Don't worry, I'm not going to ask you to report in the webinar what your score is. But we'll be giving you some tips around building emotional intelligence, as well as assessing where you're at and helping you to develop a plan around that. As you all know, emotional intelligence builds resilience, but it's also a fantastic skill to have for relationships, leadership, management. So I'm really looking forward to next week. We're kind of flipping back to providing something for you so that you can help more clients in the long run. So thank you, IEP, again, and thank you, Natalie and Andy. That's over and out from me, but I will leave the chat on because I know that people like chatting. So we'll leave that on for another 10 minutes. Thanks, everybody.
Thanks, Kylie, and thanks the team from the Better Health Generation. Another really, really interesting webinar. Please head on over to the IEP YouTube channel to get all the videos of all the webinars we've done so far in this series. And as Kylie said, look out for next week's webinar, which will be published in the IEP Learning Network e-bulletin, which comes out every Wednesday morning. And you'll be able to get the links to sign up for that, around resilience and emotional intelligence, and maybe something back for you guys personally there. So well done. Thank you very much for joining us again, and we'll see you next week.